Good morning once again, and thank you for giving me the opportunity to be part of this panel. We've heard the data, we've heard about the global picture, the statistics and all that. So basically, I'm going to look at how is Africa faring? How are we, how are we doing? Are we doing good, or we need to step up in terms of our game? Yeah, so as mentioned, I work with the International Drug Policy Consortium, a global network of civil society that advocates for drug policy grounded on health, human rights, development, and social justice. So if you look at the nature of drug policies generally across the continent, it's basically rooted in the prohibitionist perspective of interpretation of the international conventions. We basically, especially in terms of our governments, the main focus is more on criminalizing people, arresting people, seizures, the amount of seizures we are making across the continent, the amount of people we are arresting, the total, these are the things that basically many governments across the continent are doing. Now, if we look at our performance, I will say that it isn't too bad, but of course, we need to improve upon what we are doing. If you look at the Global Drug Policy Index that was launched in 2021, it was done for, I think, about 30 countries. We had about 7 countries in Africa that were also assessed. We had South Africa, Mozambique, Ghana, Senegal, Uganda, and some few other African countries. And we did not really do that well. If you look at the statistics, Africa wasn't really doing well. And that is not surprising because we know the kind of focus in terms of our government perspective in terms of drug policy. And if you also look at some countries currently, there are still some countries that still have the death penalty in their laws, which are still being, probably might be dormant, but of course we need to do something around that. Now, if we look at these approaches, we've heard Gunnar this morning, especially in terms of the health implications of the over-criminalization of persons who use drugs, especially focusing more on supply reduction strategies other than putting in resources to address some of the unintended consequences of the focus on the war on drugs, we've seen a lot of human rights violations where people are arbitrarily arrested. We have heard in other countries where people are even executed for drug offenses. We've also seen instances where our prisons are overpopulated as a result of these petty non-violent offenses. And of course, 2021, we did some kind of like a rapid assessment of prison populations of minor offenses that are packed in our prisons. We looked at South Africa, we looked at Ghana, we looked at Nigeria, and it will amaze you the number of persons who are serving jail terms for just minor offenses like a wrap of cannabis, small quantities of cocaine, small quantities of heroin. And it's worrying that we are pushing a lot of resources into these areas other than investing these resources in areas that can improve the lives of people whom we are, who are citizens, who are brothers and sisters. So there's need for us to begin to rethink our drug policies. We need to think outside the box and see what we can do around that to improve upon our drug policies. Also, in terms of availability of essential medicines, yesterday we heard about how, I think, close to about 0.5 metric tons in terms of availability, how essential medicines availability in terms of the continent consumption. That is not to say that we are not really consuming these, or these substances are not needed for pain management. They are needed, but of course, if you look at most of our laws, they place a lot of impediment in access of some of these substances. And of course, if you look at the structures that are even put in place to access these essential medicines, it's so the bureaucratic process in terms of how to even get these substances available for medical use are quite cumbersome, and many countries will not do that. I remember 2008, and we were looking at access to pain management, especially respect of tramadol use within West Africa in selected countries, and you visit big-time hospitals, and they'll tell you that they don't even have morphine for cancer patients. And this is as a result of some of the impediments we have put in place in terms of our laws that are denying people of these essential medicines. And I always say that these denials are gross violations of human rights of these people, and we need to do something around that as a continent. Sorry, I'm so sorry. It looks like I messed up with the slide changer. Now, so if you look at Africa, are we really seeing a shift in terms of moving towards more humane drug policies, putting people at the center of our policies, putting communities at the center of our policies? I would say that, of course, yes, we are seeing a change, despite the fact that it's a little bit slow, but we need to at least take some steps to make sure that that happens as a continent. And of course, we need to be looking at a comprehensive approach to this drug policy. We need to make sure that it touches on all areas. Of course, many of our governments, the focus is more on the security aspect of things, and of course, resources are being channeled to that direction. And that's not to say that we shouldn't focus on the security aspect, but of course, other areas need some improvement, and we need to make sure that we do that. And some countries are now beginning to also appreciate the human rights conversation of drugs, and which is good, because we have seen over time countries that are now even considering the conversation of reviewing their laws. Some have actually taken steps to do that. We have seen countries like Liberia, we have seen countries like Ghana that have taken steps to actually sit down and look at the laws. They might not be perfect, but of course, there has been that appetite in terms of making sure that we review our laws to do that. And then also, we have seen the desire and the appetite within the African Union itself in terms of looking at how they can encourage member states themselves to ensure that these policies and laws within the national level reflect a comprehensive nature. The action plan in terms of the 2019-2023 action plan of the African Union actually emphasized on the need for many member states to focus on making sure that there is access to what? Harm reduction, there is a removal of criminal sanctions in terms of persons, alternatives to imprisonment for persons who use drugs, and also ensuring that there is access to essential medicine for pain management. And I think we are doing well. We are not doing too bad. The fact that the desire and the appetite is there to have this conversation is something good that we need to really continue to do. We have also seen in terms of countries that are now beginning to focus more on harm reduction. That is, of course, we've seen quite a number in terms of, if you look at the Global State of Harm Reduction, the 2022 report, many other countries are beginning to implement harm reduction, which is good, but I have always said that in as much as we appreciate the services that we are providing for these people, if we do not do something about the legal environment, the criminal environment that is still created for these people, it is becoming difficult for many of them to come out to access these services. So as much as we are providing services, let's also look at the laws themselves that place an impediment in accessing these services by these people. So we need to also review the laws. We need to decriminalize drugs and take away the stigma and the discrimination that these people go through to be able to access these services. Now, of course, I've mentioned a few countries. We have seen Ghana, where they have introduced fines other than custodial sentences for persons who use drugs. Ghana has started in terms of putting in place some measures to start harm reduction in November in terms of a pilot study. We have also seen the law that is passed on cannabis in terms of regulating cannabis production for medical and industrial purpose. We have also seen Morocco that has also done a lot of things in terms of cannabis and then also harm reduction policies. South Africa in 2018, as we all know, the Constitutional Court did make some pronouncements. And I am looking forward to this, a day when we'll really have this, a policy that really addresses the key issues on the ground, because we talked about the fact that it is decriminalized for personal use within private space. What happens to persons who are supplying? What happens to people who are selling? Or what happens to persons who are also distributing as a social way of generating resources to support even their own drug use? Because if you look at the law, it still criminalizes these people, and the law is still harsh on them. We've seen Senegal, in terms of harm reduction, there has been progress in terms of making services available to these people. Now, in terms of priorities, where should we focus as a continent? What should we be doing as a continent? And I believe that the implementation and awareness of the action plan of the African Union itself, in terms of the common position, as well as the international guidelines, are basic. They are the basis from which we can actually draw inspirations to work around our laws and improve upon them. We also need to scale up in terms of harm reduction, as I mentioned much earlier on, in terms of looking at domestic funding, because if you look at harm reduction, it is donor-driven. And how long can we be relying on donor support for harm reduction? Does it mean that when this is withdrawn, everything comes to zero? We need to begin to look at it from the national level perspective. How do we get our governments to commit to putting in resources to ensure that there is continuation of harm reduction at the national level? And as I said, decriminalization is something we need to consider seriously as a continent, because so long as people are criminalized, they are not free to be able to access what you have put in place to support their lives. And we also need to engage with our governments. Our governments must begin to be participating in most of the conversations around drugs. Open, honest debates must take place in at our national level and at the regional level. And we need to get them to be engaging also at the global level, because sometimes you go to the global space and our governments are not really telling us what is happening. They are not saying much, and we need to hear their voices and what the international commitments they have committed themselves to. We need to hold them accountable to that. And we need to make sure that civil society is also ensuring that there is that audit in terms of what is happening at the national level against the international commitments that we have at that space. So of course, in terms of the conclusions, I will say that if you look at the drug policy generally across the continent, there is a wide disparity in terms of what policies are being put in place, what is implemented. There's so much vast disparity in terms of what is happening on the ground. And then also, disproportionately, the laws are affecting very marginalized, poor communities. And that is something we need to look at seriously. And we also need to build bridges and engage states across Africa to make sure that there's further progress in terms of the work. We need to divert money spent on policing to ensure that that money is put into harm reduction and other strategies that we need to do. And of course, develop a constructive debate that will lead to more humane and evidence-based drug policies. And as I said earlier, we need to ensure that there is that civil society audit of national governments against the international commitments that we make. We go out there, we commit ourselves to certain things, certain resolutions, we come back at the national level, nothing is done. And I challenge our civil society in this room that we need to begin to hold our governments accountable. We need to do civil society audits around that. Thank you very much. I'll sit here, and then when there are questions, we'll pick up.